as bad as the eyes, causing glaucoma, leading to blindness. The heart, the kidney as well is not left out if not properly managed. That is to tell you that diabetes is deadly. It is very, very terrible if not properly managed. Before we talk about the types of the diabetes that we have, so that people can understand that even the word itself, diabetes, is not just a one-way traffic. There could be diabetes of this, diabetes of that. I want us to talk at length. I want us to take our time to talk about what exactly causes diabetes. Before we even talk about the types of diabetes, what are the causes of diabetes? The very common thing anybody will think of is they'll just tell you, oh, sugar. They'll just tell you the cause. If you hear someone has diabetes, they'll say, oh, that man takes too much sugar. If this woman has diabetes, oh, she used to take too much sugar. Can you tell us what are some of the causes of diabetes?
There are various causes of diabetes. Like in type 1 diabetes, for example, there is the body system, there is antibodies. The body develops antibodies against its own cells in type 1. So there is an organ in the body that produces insulin. I mentioned earlier on that insulin is the hormone responsible for moving sugar from the blood into the cells. So the body develops antibodies against this pancreas that produces this insulin. So it destroys all the cells producing the insulin. So there's no insulin at all. That's for type 1. So now, when there is no insulin, the sugar is just there in the blood. It's not able to move into the cells. So we have a state of, you are living in plenty, you are around, surrounded by a lot of goodies, but you are not enjoying it. You can't make use of it. So that's what happens in type 1. But in type 2, there is insulin, but the body cells are resistant. They are not recognizing the insulin due to obesity, excess fat in the body. Some people in some other hormonal conditions, maybe hypothyroidism. There's something we call hypothyroidism. There's a gland in front of the neck that produces an hormone called the thyroid gland. So when it is not functioning well, this can lead to resistance of this insulin in the body, and also some other hormonal abnormalities. And apart from that, there are risk factors that can predispose to diabetes. Okay. Some people will tell you that I've been living my life healthy, I've been doing this, I've been doing that. The adventure the father has, the mother has, and such a person has a risk factor like obesity.
Yes.
Sedentary lifestyle, just eating everything up and all that, not exercising, can also have develop diabetes mellitus. The individual can also develop diabetes mellitus. Then smoking and some other alcoholism, some other lifestyle challenges can also predispose. But genetic is one of the major risk factors for type 2. But in type 1, like I said, it is autoimmune.
Okay.
You cannot explain it. The body is just producing antibodies against itself. So, and before you know it, that's why they come in, most of the time they come in very low. Although it could also occur in adults, but most of the time they come in very low. So there are more of like risk factors to developing diabetes for type 2 than causes. So I wouldn't say that, okay, if you take a lot of sugar, you will develop diabetes, because of the truth, there are people that consume coke, consume a lot of that, and they don't have diabetes. And there are people that don't do that and develop diabetes.
End up having it.
So it's more of risk factors. Having a father or a mother or a family member that has, predisposes one to a higher chance of having. So if there's not a combination of one or two factors, maybe obesity, lifestyle, smoking, alcohol, with that, such an individual might come down with diabetes mellitus. And also some gynecological situations. There's something we call polycystic ovarian syndrome. It's also an hormonal imbalance. There's also an hormonal imbalance in PCOS. So that could also predispose to diabetes mellitus. So there are so many risk factors.
There's so many risk factors. While you were talking about that, you were talking about those that has tendencies of being affected with diabetes. You talked about those that smoke, those that drink. Obesity is also not left out. Please let's illuminate that angle a little bit for the benefit of those listening. Who are those that are having more tendencies of being affected with diabetes? Are there persons that, okay, oh, if you are this kind of person, there are possibilities that you should be expecting diabetes?
Yes. Obese people, for example. And when I mean obesity, what is obesity? I think I've spoken about obesity before on this radio station.
Yes.
So when the BMI is more than 30 kilogram per meter square, that's the ratio of the weight to the height. So when an individual is fat, let me just use that word, fat.
The common word.
So the fat cells in the body are very high. And when the fat cells are high, there would most likely be resistance to insulin. So that means the fat cells are not making the body is not seeing insulin as if it's there. So there's relative insulin deficiency. That means insulin is there, but the body is not
seeing it.
So, and someone that consumes all sorts of things, you sit down in front of TV from morning to evening. You don't even exercise, you don't do anything. So whatever you are eating is just being stored in the body as a fat, because we eat carbohydrates, protein, or whatever class of food we eat. It ends up as being digested into glucose. So the glucose, excess glucose, will be stored as fat. So when fat cells are much in the body, can lead to diabetes. There's diabetes in pregnancy, which could resolve after delivery of the baby, but it can further progress to become a chronic one. So that is also a risk factor.
Talking about diabetes in pregnancy, that seems a little bit strange. A little bit. Can you put us through how does it happen? Is it from the mother or the child, or who will be affected when you see diabetes in pregnancy?
Okay, well, there are some risk factors, like someone that has had a very big baby, or someone that usually gives birth to big babies.
Okay.
When I say big babies, like 5 kilograms and above.
Chubby babies.
So the next pregnancy, they are prone to having diabetes. The mechanism is not really clear.
Yeah.
Then for someone like that has polycystic ovarian syndrome, what it simply means is that the ovary, there are so many cysts in the ovary. The ovary is the organ that stores egg in a woman. So there are so many cysts in the ovary, and it could lead to some hormonal imbalances. And this can also predispose to diabetes in pregnancy.
I want to ask earlier, while you were having this talk with the kind of causes, the things that causes diabetes, you mentioned, you talked about diet. Now put us through how important, or what role does that play when you talk about diabetes? Is there a major role diet plays in diabetes?
Okay. Well, diet alone will not cause diabetes.
Okay.
Diet alone will not cause diabetes, but for people with diabetes, diet is a very, very important factor in their blood glucose control. Because there's this misconception that people that have diabetes should not take carbohydrates, they should not take sugar, they should not do that. And that's why when we see our patients, we refer them to a dietitian to let them know that it is not that when you have diabetes you cannot take carbohydrates, because to function as a human being you need all the classes of food, carbohydrate, protein, fat and oil, but it is the quantity. It is the quantity. So for someone now that has the risk of having diabetes and is now loading himself with pizza, shawarma, all these pastries and all that, the rate at which he would develop come down with the symptoms will be faster than someone that has been living a healthy lifestyle, eating balanced diets, protein in the limited quantity, carbohydrates in limited quantity, does not take soft drink, does not do this, does not do that. Their chances are
way different.
So that's where diet comes in. So someone that has the risk of having, you're not like, okay, since my mother has, my father has, I'll not kill myself, I know I will have. Let me just, so you're just helping. But that is not to say that people that take all these things will come down with diabetes.
Okay.
It's just increasing the chances of coming down with diabetes. For people that have the family or the genetic predisposition to having it.
Thank you very much for that one. If you're listening to us, we're talking diabetes today on the issues here on IKD 106.1 FM with our guest. This is not our first time of being here. She would always deliver just like she's currently doing now. If you have questions to ask us as regards our conversation, do well to call us on our studio lines 0904-081-1061 or 0904-082-1061. Your questions, of course, we expect should be in line with our conversation talking about diabetes. Coming back to you, Dr. Additional, I want to say thank you for still doing justice to our conversation today. Let us look at some of the symptoms, because earlier you also talked about the fact that early diagnosing is what actually helps you manage it well. But if not, it could go as bad as affecting the eyes, the heart, the kidney, and the lights. What are some of the symptoms that people should look out for if you start feeling like this or you start seeing this? Oh, please know that this is diabetes coming.
Okay. I'll start with the classical symptoms.
Okay.
I mentioned polyuria, that is excessive urination, or waking up more than 3 times at night to use the toilet, to urinate. Then excessive thirst, feeling thirsty all the time. Some people can, take as much as 5, 6, 7 liters of water, because the more they are urinating, the more thirsty. Then, because of the glucose in the blood, that's sending signals to the brain that they are dehydrated. So they need to take more. Then weight loss, that is also one of the signs of diabetes. Then abnormal sensations in the hands, in the legs. Some feel as if they are having burning sensation or pins and needles. They are just sitting down, they are telling you that I have, in Yoruba they will say I'm having paja. Frequently. And some will tell you it's as if they are burning my feet under fire. With these other symptoms could point to diabetes. Blurry vision. Someone is complaining that they can't see well. Someone that could see well, they'll tell you that they have a feeling as if cotton wool is being put on their eyes. They can't see clearly. Some will even tell you that their urine is foamy, like soap. So it could also be a pointer to diabetes mellitus. Then some of the other symptoms we talked about, like poorly healing wound. They could have a wound that will not just heal. They will tell you it's a spiritual attack. It's no spiritual attack, it is diabetes. So for someone that comes in with poorly healing wound, one of the foremost suspicion is diabetes. So until we've ruled out, then we can now go into other differentials or other things we know could cause that. But that is one of the earliest signs of diabetes mellitus.
Thank you very much. You've made it known and you've made it very clear that diabetes is a chronic disease that takes life or damage the human system if not properly managed. Now, this is the bridger to the conversation. Another level to this conversation is there are a lot of people out there who are currently managing diabetes. And then we have some set of people that they already know this thing is there. But the first thing that comes to their head is, oh no, if you talk about diabetes, it's expensive to manage. It's expensive to treat. You being a medical practitioner, what do you have to say? What can you tell people that believes that managing diabetes is expensive? Or do you also want to say, yes, truly, if you have diabetes, know that serious business is very expensive to manage? How true is that?
Yes. Managing diabetes, now Nigeria of today, managing any disease condition is actually very expensive because the cost of medications, cost of running tests, investigations have all gone up. But I usually tell my patient that when if you are saying the management is expensive, then if the complications are much more expensive, they are much more expensive, and most times they are irreversible. You cannot reverse them, you cannot change them. So it's not better to manage them. And in fact, there's a patient I knew then. The man is of blessed memory now. He was 90 something when he passed.
90 something?
Yes, and he managed diabetes for over 40 years.
One could manage diabetes for over 40 years?
Yes. He managed diabetes for over 40 years. And what even killed the man was not even the diabetes. was something else.
I was going to ask.
It was something else. It was not the diabetes. So it's a chronic illness that once one can just be diligent with the medications, with the follow-up, with investigations and all that, with God, one can be guaranteed of a long life with God. Because we doctors, we can only care. It is God that is. That's what we say. But at least one should be compliant with the drugs, the investigations, with follow-up. Or some of our patients, they get tired along the way because it is not easy, I must say. Using medications every day of one's life. Even some have to be on injections. Like type 1, there's no insulin at all, so they have to be on insulin for life.
For life.
For life. So it is not easy at all. But what I usually say to encourage them is that, if you do these things, you will be in, and you are healthy. It's not better than avoiding them or not being compliant and coming down with complications. Because those ones are even more expensive to manage, and the quality of life is reduced. So I wouldn't say it is cheap to manage. It is not cheap. But looking at the benefits outweigh the other side. The benefits, outweigh the costs. Let me just put it down.
Thank you very much. Now, you talked about some of the effects of these things. Let us look at how the diagnosis goes. It's another thing for you to diagnose this thing at the early stage before it gets bad. Some would only discover or know that, they are battling with diabetes when it has gone as bad as the eyes, the kidney, the heart, etc. What is the process like to diagnose that, this is diabetes?
Okay, well, for some people, they are just picked up on routine screening. I said a lot of people have it, but they don't know. It is when they come down with complications that they come to the hospital and they are now diagnosed with diabetes. So ideally, what we do is when they come with symptoms of excessive thirst, excessive urination, weight loss and all that, we take their blood sugar, we take their blood sample to test for the fasting blood sugar. That is when they've not eaten anything at all. So anything 7 millimole per liter and above, which is 110 milligram per day, is the way we calculate it, is diagnostic of diabetes. Or 2 hours, after they've eaten, then 2 hours later, we check the sugar. This is more than 11.1 millimole per liter or 200 milligram per day. With those symptoms I mentioned, it is diagnostic of diabetes mellitus. And there's also one thing we call HbA1c, which is glycated hemoglobin. We have hemoglobin in the body. Hemoglobin is the oxygen carrying pigment in our red blood cells. So the glucose in the body attaches itself to hemoglobin. So we also measure that HbA1c. So if it is more than 6.5%, it is also diagnostic of diabetes with those symptoms of excessive thirst, excessive urination, weight loss, or even one of them. It is diagnostic of diabetes mellitus.
Let's talk about some of these symptoms. When you earlier said that excessive urination, the person will just keep using the restroom over and over again. There are some people now that might just start getting scared that, I use the restroom like many times, but I feel healthy, I feel good. Does it mean that if somebody uses the restroom like regularly, that is diabetes, or it might be that it might be, or it might not be?
Well, it might be, it might not be. It might be. It might be, it might not be in the sense that some people take a lot of water. They naturally drink a lot of water. I have a friend like that, and she's not diabetic. But she just likes taking water. So she uses the restroom. But at the point she was worried. She went to screen herself and she found out she was okay. Then there are some other disease conditions. There's something we call diabetes insipidus. That one is not related to sugar. It's another form of diabetes. It has to do with an hormone in the brain and all that. Those ones would urinate excessively, but there is no sugar in their urine. What causes excessive urination in diabetes is because there's excess glucose in the blood which is filtered into the urine. So wherever glucose is, to pull more water to itself. So that's the reason for that excessive urination. So they keep urinating and urinating. But it doesn't mean that everybody with excessive urination has diabetes. Diabetes will not usually come with one symptom. It usually comes with those other things I mentioned.
Now, I want to, sorry to interject you there. I want to ask, talking about the symptoms, this and that and all. And then some will tell you that, okay, me, I have gone through the screening, I've checked myself, I do not have diabetes. For you, what would your advice be to people out there? How constant? Is there a duration of 1 month, 2 months, 3 months? For instance, when you brush your teeth, medical practitioners, you have advised that you brush your teeth at least twice daily, in the morning and at night, to test yourself and check yourself if you're safe and free from diabetes. How constant should you do your diagnosis?
Well, I would say as regular as possible. Like, if it's a monthly thing, I wouldn't subscribe to a weekly thing, because that would be just putting unnecessary fear into one. Just like the way you check your BP. You should check your BP as regular as possible.
True.
You should also check your blood glucose. But if you've done it once, twice, thrice in a year, and you're saying that it's normal, and you're living your life healthy, I don't think, well, a monthly thing is not bad. 2 months, 2 monthly check, 3 monthly check, 2 is not bad. But at least in a year, you should at least check a minimum of 4 times, to a minimum. Even if you are not doing at all.
In a year, minimum of 4 times.
At least. At least. Because that HbA1c will show the glucose control in a 3 months, over a 3 months period. That is what HbA1c would show, glycated hemoglobin. So over a 3 months period, it will show that the sugar being controlled over this 3 months period. So if you do it every 3 months, that's 4 times a year. So at least, I would say at least 4 times. But if you can afford more than that, why not?
You can go ahead. Okay, we have just 10 more minutes on the issues today before we wrap up. Still, again, I want to say thank you very much for staying with us, Dr. Additional. Now, let's talk about healthy lifestyle, which is also very germane and important. And to start with, I want us to talk about those living with diabetes. It's very common. We hear things like, if you have diabetes, don't eat this, don't drink this, don't do this, don't do that. For you, what would your advice be, or how best can you professionally advise people living with diabetes on how to live a healthy lifestyle, what should be taken and what not to be taken?
Okay, thank you very much.
Yes, please.
For people living with diabetes, first and foremost, I'll be talking about their diet, I'll be talking about their drugs, I'll be talking about food care, because it's very, very important. Then drugs, diet, food care majorly. So for their diets, like I would say, having diabetes does not mean you cannot eat carbohydrates, or it is just limited. So this is what we would say: carbohydrates should not be more. I have a very big fist, but for some people with smaller fists, they will say the carbohydrates should not be more than this small fist. Then a lot of vegetables, then a lot of protein too. Protein. Then the fruits, just minimal. There are some fruits that we know that have high sugar content. Those ones are minimal, maybe twice a week. A slice of orange, for example, or half of orange, maybe once in 3 days. Or watermelon, a slice, maybe once in 3 days. There's a way the dietitians, they would best be able to explain this more. But what I just want to point out is that having diabetes does not mean you cannot eat your rice. It's just that the quantity is little. Doesn't mean you cannot eat your bread.
That means you can't eat it again. Don't go close.
No. So I correct a lot of my patients. Doesn't mean that you cannot eat your rice. Doesn't mean that you cannot eat your bread, but just a little. So you can put a lot of beans. You can put a lot of vegetables. Then instead of eating the normal yam, this sweet potato, the glucose there is more complex than the normal yam. So it's even better than yam. You can eat a little with a lot of garden egg sauce, something like that.
Okay.
Then you can eat your bread, maybe just 2 slices with beans. You can eat whatever, but it's just the quantity. because you still need carbohydrates to function normally. So that's then fruits and vegetables also important. The kind of fruits, those sugary ones should be limited. Quantity should be very little. Then the drugs, very very important. Being compliant with medications. If your doctor says use this, use that, then comply with it. I've seen so many people come that and I also use this herbal medication. They said it's bubonishi. The truth is that most of those herbal medications, they would have gotten this metformin and all that. They grind it together with, and they mix it together with all sorts of things and tell you that once you take this, the diabetes is gone. It might crash the blood sugar for that minute. And when you check it, my sugar is normal. It's never been normal. This is good. But it is a lie. If such an individual should check in a couple of weeks' time, you see that you are back to square one. And some of these things, the quantities are not even regulated.
They are not measurable.
They are not measurable. They can lead to kidney damage. Remember, someone with diabetes has a risk of kidney damage. They're now taking herbs. You are giving the kidney double work. You are giving the liver double work. So it could lead to that. So being compliant with medications. Don't feel that your sugar is so high. Then you know, if asked you to take one, you are taking 2 or 3. There is what we call hypoglycemia. That's low blood sugar. That one even kills faster than when there is hyperglycemia, which is one of the signs of diabetes. Hyperglycemia, that's high blood sugar. So low blood sugar kills faster. So being compliant with medication, visiting the hospital regularly is very, very important. When they tell you to take insulin 10, don't go and take 12 or 20. If it is too low, it can lead to death. Then number 3 is foot care. Very, very important in our people living with diabetes, because one of the parts of our body that is easily bruised or is in contact with the environment is our legs and our foot. So once a wound develops there and the sugar is not controlled, it will not heal. But for a diabetic with good glucose control, their wound heals on time, like the normal individual or like the healthy individual. Let me put it that way. So, but if the glucose control is poor, the wound might be there for years. And most of these people would have been at home, managing the wound at home. And when they now see that it has become complicated, they will now come to the hospital. So for the foot care, what do? You make sure you inspect your foot every morning and evening to check for cuts, to check for bruises, to check for swelling, and make sure that the foot is not too dry. It must be moisturized all the time. And you must always inspect in between the toes for any bruises, any cuts, or any sign of fungal infection. Then whenever they want to cut the nails, make sure you use a nail cutter and not a blade, because you can accidentally cut yourself while using a blade. But with a nail cutter, the risk is reduced. And also when you want to buy your shoe, make sure it is in the afternoon when the foot might have been swollen by then, so you are sure you are getting your correct size of shoe. You are not wearing something that is too tight, because that can lead to bruising. And make sure the shoes are not too high, like these pointed heels. Someone with diabetes should not be wearing pointed heels. No. And you should not wear open shoes or slippers and be walking around, because if you are walking around, the leg can hit anything and could develop a wound which will not heal. For our mothers at home, avoid holding your pot of amala or pot of eba with your feet.
Why trying to turn them?
It is not advisable at all. And always make sure that when you are walking around the home, you are wearing something to protect yourself. Because we all know our children, little children, they could throw sharps here and there. Make sure you are doing that. And like I said, always inspect the foot from time to time. And peradventure, if you have a wound, you should always go to the hospital. Don't go to chemist or anti-nurse, because they might just think it is an ordinary wound and dress, and they will not even know
it's beyond that.
It is beyond that. So seek the right source of treatment. That is very, very important.
I want to thank you very much. We will be signing out very, very soon, in less than 5 minutes from now. Let's try to strike a balance with this conversation. You've done well to talk about the way of life for people living with diabetes, a healthy lifestyle. Let's come down to those that are not living with diabetes too, so that they won't feel left out. how should we live our lives in order to avoid, in avoidance of diabetes?
Okay. You should live a healthy lifestyle. And when I mean a healthy lifestyle, avoid being idle, being sedentary, like sitting in one spot, not exercising. Because the truth being told, for people, some people do not have any family history of diabetes, and they come down with diabetes because their lifestyle is not healthy. For someone that has been obese from childhood, that person has a high risk of doing that. So you must have a healthy weight. And how do you do this? Try to exercise. In fact, I usually say to people now that this fuel subsidy thing has really helped a lot of people to walk. And you know, walking, those days when our fathers used to walk, most of these chronic illnesses or chronic diseases
wasn't in existence, yes.
So we must be active. We must be active. We must exercise ourselves. We must eat healthy. Because of things is not doing justice to that now. People find it difficult to eat balanced diet or eat fruits and vegetables. I will find out that the junks are the readily affordable.
That has become the order of the day now.
And this is not helping us. This is not helping at all. In the little way you can try as much as possible to eat healthy. That will also help. That would also, in fact, I know some people with diabetes that are not even on medications. They are just on dietary regulations and they are doing well. They are on dietary modifications and they are doing well. So our diet is very, very important. For people that take alcohol, reduce your alcohol intake. Don't take excess. Reduce your alcohol intake. Then for people that smoke like we know that smokers are liable to die young. Of course. It does more harm than good to the body. So we should generally inculcate a healthy lifestyle, and that would help. Even for people who are at risk of developing this, it could help them and prevent them from developing these complications. And if you notice that you've been having some symptoms that you don't understand, don't wait until the complications set in. Go to the hospital and get a nearby health center or an outreach, wherever, and get yourself tested. Because if you know on time, you can save a lot of things from happening. Thank you very much.
Thank you so very much. Before your parting words, I want us to come down to Ikorodu here and the people that can hear you at this time. You've given all us reasons why we should check ourselves. And just like you rightly mentioned, at least 4 times in a year. The next place anybody wants to think of right now is, okay, if Dr. Additional says we should always check ourselves and be sure we don't have diabetes, or even if we have, then we should start managing. We should be General Hospital. For General Hospital, what is the availability like? What is the process like? When are your doors always open? When you talk about those that needs to check their blood, I don't know how you put it, the blood sugar level check and all that. How is the process like? Are the doors always opened anytime, any day? Or there are specific days when you can do all of this check in order to diagnose whether you're safe or you need to be safe?
All the doors are always open, Monday to Sunday. The lab is always open 24/7. So then the doctors are readily accessible. So once you walk in, you obtain a card and you see a doctor, and give your symptoms to the doctor. The doctor knows what to write, what investigation to write for you to go and do. And once they've seen this, they reassure you that okay, your levels are normal. Or if they are abnormal, they tell you the next thing to do.
So to check if you have diabetes or not, just get down to General Hospital, get a card for yourself, and then lay whatever complaints that you have. I want to thank you so very much, Dr. Additional. What will be your parting words? And if you are doing that, I would like you to also add family members of persons that have people around them living with diabetes. When you talk about diabetes, there are sometimes that family members are not helping too. The husband tends to neglect the wife. The wife tends to see the man as a liability because of diabetes. What would your advice be to family members, relatives, or people living with diabetes?
Well, I would want to encourage them to be supportive, because it is not easy. It is not easy to be in the patient's shoes, and as well, it is not easy for those running around. But with the appropriate support, one could prevent complications. And why would a diabetic patient be hospitalized if the glucose is well controlled, if everything is? That would even reduce the burden, the financial burden on the family. So, like I would say, prevention is better than cure. Prevention is better than cure. For elderly people, I want to encourage their children or their caretakers to always ensure they purchase their medications, to always ensure they make money available and accessible to them to buy whatever they need to buy, to do investigations, because some of these people, it's not as if they don't want to do, but there's no
Support and funds.
support. There's no support, and some of them come to clinic, they break down in tears, which is not supposed to be. In our own little way, let's support that family member that has diabetes, because it's already going down on their psychology. So if they don't get that psychological support, they could also be depressed. Then on the family members that are supporting too, I want to encourage us to keep doing, because we can only try our best to be healthy, but God has everything in his hands. So you don't know what could be of you tomorrow, so you don't know who could come to your own help. So try to be good to those around you suffering from one health challenge or the other. They could be useful to you tomorrow in one way or the other. Even if they are not, at least they are saving your life. So please, in any way we can support them, financially, with words of support, psychologically, it is very, very important. And for those people living with diabetes, it is not the end of the world. You can live, if God permits, for as long as you want, with the proper medication, proper checkup, and proper way of life. It is just a mindset. It is just one's determination.
Thank you very much, Dr. Additional. This is where we draw the curtain, we draw a close to the issues today on IKD 106.1 FM. Of course, tomorrow being Friday will be another time for us to have another discussion here. Now, do not forget that every Saturdays as well as Sundays, we have a repeat broadcast of Bawadasi and the issues. Do well to join us every Saturdays and Sundays, 6 p.m. up until 7 p.m., where you would have the opportunity again to listen to these conversations. Diabetes is a chronic disease. It is as deadly as HIV or any other disease that you can think of. You've heard that from Dr. Additional, but that we can also tell you that you could live a good life even with diabetes. There are records and reports of persons that lived over 40 years with diabetes. Remember, your health is important. God bless Nigeria. God bless Lagos. Thank you very much, Dr. Additional. I am very sure that the entire staff and management of General Hospital Ikorodu are so proud of you. Again, you have delivered. I am Opeyemi Adibambo. Until tomorrow, same time, same station. God bless you.